Dr. Andrew Forsyth is with us here at the Como Lake Veterinary Hospital, and we're talking about, and we brought Lucy in, and she doesn't like the vet, so you'll hear her in the background. We'll bring her up in a second, but we're talking about joints and how important they are with dogs.
Joint health and arthritis.
Yeah.
Arthritis is a big issue in our dogs' days. We get a lot of dogs are living longer. They're getting more diseases like cancer and arthritis.
Right.
And cancer we're getting better at, but arthritis as well, we're getting really good at managing that. And so we're allowing these dogs to live longer, more productive, more comfortable lives later in their into their old age.
Okay. All right, so let me just bring Lucy up here. She's, I love this.
There she is.
So now you surprised me a little bit because you said Lucy was a tiny bit, you thought she was carrying a little extra weight. Yeah.
Yeah, she's 75 pounds, and she should be probably closer to 65 to 68 pounds.
Okay.
And at 4 years of age, that's not really a big deal. But as she gets older, carrying those extra pounds over those years are going to take their toll on her joints and on her cardiovascular system as well. So we like to have dogs as lean as possible.
Okay.
And it just makes sense for them.
Now, does that mean she needs to go on a diet? Like, would she need to just less food, that type of thing?
Less food. We don't like people to go crazy with exercise.
Okay.
Exercise won't cut it alone because dogs are very good at exercise. We're not so good. So it works pretty well for us.
Okay.
But calorie restriction and mild exercise.
Okay.
It's just like for the sun run. You don't go crazy.
Yeah.
You start slowly and you work up to it.
Now, when you say joint health, what is it that we're looking for Lucy? Because she's a lab, so she loves to get out and about, and she loves to run. So what are some early signs that there may be a problem?
Okay, very good. Labs, it can be very insidious at the onset. It can be very slight. It can be a reluctancy to go upstairs. It can be she just spends a little more time laying down on her bed and less time with the family.
Okay.
Sometimes we can even see house soiling issues. They pee or poop in the house because they're sore and they can't get out.
Okay.
Those types of things. Pet owners are usually pretty good. A lot of times we see dogs that are in a little bit of pain, and they're silent sufferers.
Yeah.
So you gotta pay attention.
She's like that.
Yeah.
She just sort of doesn't say anything when something's wrong. Now, what are you using now to treat dogs with mobility problems and joint problems and things like that?
With mobility issues, an ounce of prevention is certainly a pound of cure. It makes a big difference if you can prevent a problem rather than treating it.
Good girl.
Good dog.
Good.
So what we want to do, there's some excellent diets out there for joint health, and you can do we have our own golden retriever on these foods, Hills JD and Medi-Cal Mobility Support.
Right.
They're foods that are formulated for joint health, and they're anti-inflammatory in nature, and they help quite a bit.
Okay.
Glucosamine. Glucosamine is always a good supplement. There's no downside to it. There's no toxic side effects. You supplement on a daily basis. It's not something that will make a huge difference, but even a little bit of difference over a long period of time makes a significant difference to them.
Okay.
Weight control. We decrease their weight a little bit, get a few pounds off. Less pounds that she's carrying, there's less stress going through the joints. Makes a big difference. Down the road, we can use things like Cartrophin or Adequin. These are injections that help stimulate joint health and anti-inflammatory processes in the joint.
Okay.
And lastly are the NSAIDs, the non-steroidal anti-inflammatory drugs that take down the inflammation in the joints. And we kind of save them for last. They're more treatment. But one of our dogs was on an NSAID for about 3 years at the end of her life, and it gave her 3 years of good quality life.
Wow.
Good products for dogs.
All right, so you're okay shape, but we need to work on some things.
That's
what you're
right.
saying. Thanks very much, Dr. Forsyth.
My pleasure.
All right.